Today I'm going to talk about autism spectrum disorder. ASD is often referred to as a neurodevelopmental or behavioral disorder. People with autism can display a broad spectrum of symptoms and characteristics, which can be characterized into three distinctive types. First is the difficulties with social interaction, then is the problems with verbal and nonverbal communication, and the repetitive behaviors or narrow and obsessive interest. Children with autism generally show reduced sensitivity to pain. However, they can be abnormally sensitive to sensory stimulations such as touch and sound, which accounts for some of their unwelcome and strange, violent, or aggressive behaviors. They lack two basic skills that are essential to learning: the imitation skills and the joint attention skills. Therefore, children with autism are challenged in both development and learning, which leads to some professionals' belief that autism should be taught differently by specifically trained teachers in different settings with different teaching and learning modalities. Now let's look at some statistics about ASD. First, autism typically onset before age 3, although certain traits can be identified before age 2. ASD has increased steadily, with the prevalence at 1% to 2% worldwide currently. About 1 in 68 children has been identified with ASD. This means if you take a SkyTrain at a rush hour, there may be at least 7 children with ASD on that train. Male children are 4 times more likely to have autism. Historically, diagnosed ASD prevalence has been higher among the white children, but Black and Hispanic children have been more likely to have severe forms or co-occurring intellectual disability. While the increase in the white population reached a plateau in the mid-2000s, the rate among other races increased continuously, although they had a lower prevalence. For employment, people with autism have been identified as having substantial contribution to make in the technology sector. However, many of these individuals report difficulties in employment. People with ASD are prone to suffer from other problems. A linear relationship between ASD severity and psychiatric comorbidity was found. Studies also find the comorbidities was stable within the domain. In general, it declined from childhood to adolescence. Some common ones are depression, SAD, intellectual disabilities, epilepsy, mentally retarded to some extent, gastrointestinal problems, and sleep disorders. This table identified some comorbid psychiatric disorders for both ASD and ADHD. It is worth noting that among the 40 samples in this study, 22.5% of children with ASD are also identified with ADHD. Now, what causes ASD? Although many related factors are identified, the clear causes remain unknown. By far, the most widely accepted explanation is that ASD is caused by the interaction between genetic and the environment. First, a theory from the past proposed that parental practice might be the possible cause that have been disproved. Inheritance analysis such as twin studies have demonstrated a large genetic component for the causes. Many researchers believe that people with autism are best regarded as different ways of being from what is commonly represented or understood as normal or neurotypical, although their neurodiversity cannot be regarded as functional. Environmental factors such as viral infection, parental age, and zinc deficiency can be plausible contributors to ASD. Many environmental factors have been studied include the pesticides, halogenated aromatic hydrocarbons, heavy metals include the lead and mercury, and infections during pre- and perinatal periods. The vaccine was believed to cause ASD because the onset age of ASD is coincident with the age when children receive many vaccinations, largely due to the Dr. Harsey's advocacy based on flawed data. Many people today still believe in it. However, research does not support a link between mercury in vaccines and autism. There has a growing body of evidence of cytokine imbalances in ASD. These imbalances could have a pathogenic role, or they may be the markers of underlying genetic and environmental influences. A hypothesis is that the ill-timed exposure could cause autism in genetically susceptible individuals. Accumulated evidence also shows an important role of epigenetic factors such as DNA methylation, histomodification, and non-coding RNA in ASD etiology, which the significant differences in expression levels of epigenetic-related genes were found. Most of these factors are due to the prenatal period, which can be affected by environmental changes within the parental body. There has no cure for ASD today. Due to the diversity and complexity ASD displayed, there is a need for multimodal and comprehensive plans to meet individual needs. Here, I'm going to mention 3 interventions that are empirically supported. The first one is applied behavior analysis therapy, which typically focus on many areas of development, which are taught through simple tasks in which children are given the minimum support necessary to be successful. It incorporates a system of rewards to encourage correct behaviors, which are administered by trained staff in one-on-one session with participants. ABA is effective in reducing symptoms of ASD and improving cognitive and language function. Children with ASD receive service before 48 months of age improve more, which underscores the importance of early identification and early intervention to maximize the therapeutic outcome. Early intensive behavioral intervention is one of the most widely used and investigated treatments, which is derived from ABA and usually used to teach children under age 5. Positive results including a reduction in symptom severity, large gains in IQ, adaptive behavior, and language improvement. The core elements involves a specific teaching procedure referred to as the discrete trial training, the use of one-on-one session in the early ages of the treatment, and the implementation in either home or school settings for a range of 20 to 40 hours per week. The TEACCH method is recommended by the Individual with Disabilities Education Law Report in 1996, which is frequently used as a specialized education service in schools. The goals of TEACCH are to provide strategies that support people with autism throughout their lives and that facilitate autonomy at all levels of functioning. This program emphasizes a close working relationship between parents and practitioners. It adapts the intervention to the particular characteristics of the individual client, such as take advantage of their relative strengths, and to make use of structured teaching experiences, such as using a visually based environment. Last, the case study I found was conducted by Amy and Oveni. This case study is conducted to determine the effectiveness of a combined intervention in remediating the social skills in a 7-year-old children with ASD, who was referred to as Adam in this case. They hypothesized that Adam would improve in targeted social skills after the intervention. The primary participant is Adam, who was in his first grade. Secondary participants involve 3 of his typically developing classmates, his general teacher, special educator, and his mother. This study adopted the ABA single subject design to study changes in the behavior. Adam was assessed before intervention in the baseline phase through the social behavior assessment inventory rating scale, observed and documented social interactions using the conditional probability record, and informal interviews with the teacher and mother. The intervention lasted for 8 weeks. The researchers read a social story with Adam every Tuesday, and a cooperative group work activity took place every Friday. After discontinuing the intervention for a week, the assessment was done by using similar tools in the baseline phase to measure the changes in Adam's social interaction. Adam demonstrated increased attempts to interact with others, although his attempts usually were nonverbal or not through using complete sentence. The rating scales filled by teachers and educators show improvement by using social stories, but the changes remained in the elevated range. Aiden seems to enjoy the social stories and the cooperative group works, and he received the positive feedback occasionally as the reinforcement. The peer-mediated intervention appeared to be beneficial because it provides opportunities for Aiden to practice social skills in natural settings. Thanks for watching.